Good morning. This is Steve Stites, broadcasting live from the Dolph Simons Family Studio here at the University of Kansas Health System. I am joined here at the table with Dana Hawkinson, Hawkeye. We say it every day. People probably know that by now. I'm still going to say it every day. Who are our medical director of infectious disease or infection control and prevention. And then we have Joe LeMaster, who is on video. Joe is the public health officer for Johnson County. And Alan Greiner, who is the medical director for Wyandotte County. So the two of them will be working with us today as we talk a little more about pop health and especially what's going on in our counties and in reopening and some of the risks that we still know that we have. Both Dr. LeMaster and Dr. Greiner are faculty here at the University of Kansas Medical Center and Health System. They're both in the Department of Family Medicine. I've known both of them for quite a long time. Alan Greiner, since he's like about that tall, you can't see that on the camera, but it's about approximately 1 yard high. This morning, Dana, tell us what's going on here at the health system, though.
Yeah, at the health system still, last week we had fewer cases. This week we have a little bit more than we did. Currently we have 30 cases in the hospital. 14 of those are in the ICU. We are continuing to evaluate and work on therapeutics, so drugs to help combat this. One of the things that we are working on is the trial in association with the Mayo Clinic. So please, if anybody has been infected and has recovered, please contact the Community Blood Center for evaluation for donating plasma to trial the convalescent sera therapy.
So important to do, and our numbers today are staying relatively flat.
Yeah, and I think that we can be happy, optimistically or cautiously happy if we can continue to have, just over 30 or under 30 patients, especially as we start to open up and people will be in contact more with each other if we can keep those low numbers.
Yeah, and in fact, the University of Washington model has just predicted or doubled the number of deaths that they are predicting over a few weeks ago, in part because there's still a pretty high incidence of coronavirus. And as we open up society, I think we're going to see more and more of COVID-19 here presenting. And I know that's got to be something that for our public health institutions like our county health departments keep you up at night. I know it keeps me up at night, and I have COVID dreams. But Drs. LeMaster, Dr. Greiner, talk to us a little bit about some of the challenges you think Johnson and Wyandotte County are going to be facing and the decisions that are made to go ahead and open them up, recognizing that there's been economic toil and trouble, et cetera, as a result of closing the counties. But now as we open that up and try to return to business as usual, at the same time, we're going to expect to see more COVID-19.
I guess I can start if that is okay. I think the main thing that we are trying to deal with in each of the counties is to try and keep an eye on our numbers in terms of the cases that are coming up and hospitalizations. I think people are probably aware that things are looking in a better situation in Johnson County over the last few weeks with flattening the curve, as we've been calling it. The biggest concern that we've all had as we've been in discussion with each other is what is the best thing to do moving forward, given the fact that none of us live on an island. We're still seeing a number of outbreaks around the different counties in Kansas City Metro, and the numbers are still in some places still fairly high. So we've made the decision together to extend the stay-at-home order until the 11th, starting on the 11th of May. Then we'll be opening up again. But I think that the main thing that we've continued to emphasize to people is just to keep doing the same social distancing things that they have been doing, maintaining 6 feet of distance apart from other people, and being quite careful about their hand washing, face touching, and all that. Dr. Greiner, do you have anything to add to that?
No, I think a very similar message from Wyandotte County. I think our initial plans for the first zone that we have, which also, just like you in Johnson County, begins on May 11th, it's a pretty conservative zone. We were calling it the red zone. We're going red, yellow, green, and so we system to see what's going on, and it's possible that zone and our fairly conservative measures could get extended for a while if we are seeing changes in what's going on with hospitalizations and deaths and other bad outcomes. I think we're all going to have to change our behaviors long term, no matter what's
Hey, Alan, you sound a
going
little.
on.
So, Alan, it feels like it sounds like you may have dropped. I think it sounds like you're in a cave, and if you're able to go directly to your phone and get a little better reception, we'll try to rejoin you because we have some important messages. If not, we'll catch up to you. So, Dr. Lemaster, in Johnson County, and we know you've been involved with the state and the KDHE. Lots of issues around the economic hardships. Talk to us a little bit about how that you and the county health department have had to recognize, gosh, here are these economic hardships that we're seeing, but we also know we're going to struggle now a bit more medically and around health.
Yeah, thank you. That's a great question, Dr. Stites. I think that the thing that we've tried to do throughout this, we are working in collaboration, of course, with our Board of Commissioners in Johnson County, and we've had multiple discussions over the weeks, even leading up to the decisions that we made last week with the different commissioners, and online discussions about it, debating what the best thing to do to try and make the right balance between the needs of the public health and the risks of opening up too quickly and starting to see more hospitalizations, more deaths, as well as the suffering that people have had from the economic hardships that they've so courageously gone through to make this positive outcome that we're seeing. So I think that the main issue has been that we've done everything in a way that has been as far as we could, as collaborative as possible, taking into account all of those different factors. It's a little hard to know exactly how to bring everything into balance. At the end of the day, the responsibility of us as public health officers in the different counties is to safeguard the public health and to pay to do the right and diligent thing to try and prevent excessive deaths and hospitalizations. So that's what we've been doing.
Yeah, and it's just hard, right? I mean, I don't know. I tell patients this frequently when they ask me, how is this going to go or what's going to happen? And, so my crystal ball is really cloudy. I don't do very well. And do you have any thoughts about what will happen to our incidence of coronavirus and COVID-19 as we open up society? How's your crystal ball? I'm hoping it's better than mine.
Well, I got the same problems with cloudiness that you do, Dr. Stites, but I think we've all kind of realized, and I think that we probably will see some of these models that have been coming out of Johns Hopkins the last couple of days have predicted another wave coming. We know that there's going to be an increase in cases and hospitalizations as people start moving around more. It's just a case of when and to what degree. My concern is that if people, having been cooped up for a while, use this as an opportunity to kind of get out there and stretch their legs and go into a lot of retail stores, and we start having a lot more interaction with people in close quarters, and there is not the amount of social distancing that we'd really like to see, that we're going to see another wave in the summertime rather than in the fall, which is why we're sending out the messaging as strongly as we are to really be cautious when you're going into crowded areas where there are a lot of people, to wear masks. We really encourage everyone, following the CDC guidelines, to wear masks when they go into a crowded area or any area where they're not going to be able to maintain 6-foot distance from people, and to be careful about hand washing, especially when they're out. And the whole issue about eating and touching your face continues to be a really important thing, to be really careful about hand washing. So we're just really encouraging people in that direction. We know that that's likely to happen, that there will be more cases as we start seeing people move around.
Yeah, it's going to be hard. Well, let's turn and open up questions to the media this morning and see what we have out there. Good morning.
Good morning, gentlemen. Speaking to what he just said, Mother's Day is coming up this weekend, and a lot of people are going to want to get together with their families, and thinking that that's safe to do so. As we start to open up, does that mean that family events can get back to normal?
That's a great question. I'm going to follow up that question because I have a question around that too. Go ahead.
Okay.
Joe, what do you think? And then we'll turn to Dana.
Well, one of the things that we have probably made clear is that over this weekend, at least in Johnson County, Jackson County, and Wyandotte County, stay at home is pretty much going through this weekend. So we would encourage people to do what they have been doing up until now, which is being cautious about getting into groups that are greater than 10 people. Being inside with a crowded group where people aren't wearing masks can be an issue. So family get-togethers probably have been happening, but they need to be happening in a very careful, cautious way, following all of those guidelines around, mass gatherings. We said, not to participate in mass gatherings more than 10 people. That still would be in place over this weekend. I think that's the thought I had.
And can I just say a hats off to you all. I grew up in a family that only cheered for Missouri, and my dad wouldn't drive through Kansas to go to Colorado. We went through Nebraska. That's a true story. And Ned, on the other hand, I've been at KU for 30 years, and I'm proud to have a Jayhawk on my lapel. So as somebody who loves to see the area work together, the way the Core 4 has come together to try and handle the crisis for our metropolitan area is really pretty inspiring. So hats off to you and everybody that you guys have worked with. I think that's the way we should work together every day. Dana, thoughts about Mother's Day?
Yeah, so I definitely want to echo and redouble what Dr. Lemaster said. Absolutely. There's public health guidance, so there's already things that you should be doing and limits on people. Once we break that down, as he said, probably family get-togethers have probably been happening. So once we get to that point, you have to understand that it is, again, personal responsibility, and it's an evaluation of risk versus benefit. Maybe not for you, but is it risk for your family member who may be older or who may have comorbid conditions, things like diabetes, heart disease, lung disease, those types of things that we know can set you up for a higher risk of critical illness and death. So once we get to that, we have to understand what is our risk versus benefit. Can I see grandma? Can the grandkids see grandma and grandpa? Can we do this? There's also safe means to do that with the masking if you can. I know it's difficult if you're in your home and that's not really something, but also hand hygiene and making sure that you are practicing those things no matter where you're at.
Yeah, I think that is really important as a concept. It's kind of like who's in your circle, right? That's who's in your circle, meaning that you can't exclude the entire world.
Right.
So, maybe you can if that's okay. But we know, to your point, that there's this X amount of COVID-19 that's been out there in our community, and that's with everybody having already decided who's in their circle. Mm-hmm. And so, if you've been kind of maintaining that the whole time, that's your circle. What you don't want to do is probably blow up your circle. And I think that's probably the message. Otherwise, you may be giving somebody a Mother's Day present that they don't really want. And I think you just have to be thoughtful about that. On the other hand, if you've been seeing your mom every other day or every weekend, then that may not be so different. And that's kind of in your circle. So I think that's the right answer. And for a disease we don't know enough about, right? And a disease we don't know enough about, I think trying to maintain and be consistent with who's in your circle is really important.
Although we do know how hyper-contagious it is.
We do know that's true. We're good
Unfortunately.
like that. But it doesn't have wings, Dana Hawkinson.
Correct.
It is not a superhero. It does not
up.
jump, or supervillain, I guess. It
Right.
doesn't jump from one building to another. It travels, and we know how it travels. And it travels because when we breathe or get in our hands, we don't wash our hands, we wipe it on our face. All those things we've been preaching, they're still true.
Yeah.
All right. Other questions? It's
We
a new
have a few
sound.
this morning. This is Nate with the health system. We've had several
Still some trouble with the
questions
audio.
this week. Will it be safe to get a haircut or go to the hairdresser?
Wow, I'm hoping so because my hair is getting long, Dana. But what do you think? My wife has been really great about trying to cut it, so that's been good.
Again, I think if we keep in line with public health guidance, with Johnson County, with Wyandotte County, with KC-Mo, release or reopening criteria, I think we can do things to mitigate the risk of going to those places like getting your hair cut. Certainly, again, as Dr. Lemaster has said, masks in public. That's not to really protect you, but to protect other people from you in case you have the disease but not having symptoms. Also, maintaining good hand hygiene, things of that nature. So I think that, again, if you can mitigate all of that risk in the businesses, and I think the businesses are really trying to do as much as possible to mitigate the risk to themselves as well as to their clients, I think you can reduce the risk as much as possible and be able to do it safely when you are allowed to do that safely from the Kansas and the county guidance.
Yeah. Did we get Alan back on? Nope. Okay. So, Joe, here we go.
Yeah.
When you all were doing this calculus, you had to be thinking small businesses are really getting hurt, and there's probably no better example of that really than a hair salon or people who own their own small business with two or three people working there. What do you think about getting a haircut? How do you guys respond to that?
Well, this is an issue that I think has been dealt with and talked about quite a lot. We had a Johnson County task force that was looking at the reopening plan and when each of the businesses would be coming into starting through each of the different phases that'll be opening. The governor's phase 1 plan started on May the 4th. We'll join that on May the 11th, according to the current plan. Hairdressers, salons, barbers, and all that are not in phase 1. They don't start until they don't start reopening. Access to those don't start happening again until phase 2. So until then, that's not going to be something that people will be able to go back and do just because of the phasing, because those businesses will remain closed. There will be guidance from the cosmetology people about how that ought to work and in what way it can be done safely. Obviously, there'll be some activities that'll be harder for people to participate in, but that's what's going on. The decisions, I think, are really difficult because small businesses need to get back going. There's no question about that, but it needs to be done safely. And I think that all the guidance that's been looked at in terms of the phasing had in mind where the kind of close contacts were going to happen, and we've tried to have the businesses come back in the later phases that we're going to have more contact between people personally, and we considered barbers and hair salons personal services, so they come in a little later.
Because it is a prolonged contact, so it kind of is the very essence of you're in close contact for more than 10 minutes, and as a result, that's considered a higher risk exposure. So between phase 1 and phase 2, what will you look for to see if it's safe to go on to phase 2? We're getting a lot of dings this morning. I feel like I'm at home with my doorbell. What do you hear? What will you decide? What will you use to help you decide that it's safe to go to phase 2 from phase 1?
Right. Thanks. That's great. So we're following pretty much the White House guidelines, and those guidelines also that have come out of Johns Hopkins University and other agencies that have provided that. So what we're monitoring sort of 3 different pockets of things. Well, one is the incidence of cases. So we're looking at the number of new cases that are diagnosed both in our county and in the Kansas City area, in the counties that are adjacent to us. As well as the percentage of the tests that we do that are positives. We want to see downward trend in those 2 things. Also, we're watching to make sure that we're not seeing an excess number of hospitalizations or anything of that nature. And then also keeping an eye on symptoms. So we are monitoring the number of people that come to emergency rooms with symptoms that look like influenza, which is a similar presentation to COVID many times, or more obvious COVID-like symptoms. So we want to see downward trajectory over about 2-week period of time to tell us that it's safe to move forward to the next phase.
Okay, good. Well, other questions we have out there?
So I want to let everybody know Zoom went down. That's
Zoom
why
went
we're
down.
The dings.
Aha.
We're slowly getting back on again.
Okay. So Zoom went down, and that's that who's zooming who question again, and it sounds like a lot of zooming was going on this morning. So
there is one question: should I order hot food instead of cold food?
Okay, Dana, hot food over cold food, will it kill the virus? Or salty food over non-salty food? Actually, maybe even a more important question.
Yeah.
I'm not saying anybody with heart failure should eat salty food. Let's be clear about that.
Or on dial.
Are on dialysis. Thank you. Go ahead.
Yeah, I don't have a major opinion about that. Certainly, we know that at certain temperatures for a certain amount of time, heat can kill this virus. I think for food, I don't know that it really matters that much. People can have their own opinions. I don't think one is wrong either way. I think you're able to either order either hot or cold, knowing those types of things.
Viruses are funny because they don't have that many innate protective mechanisms
Correct.
against things that change in the environment. They need a pretty controlled environment to survive. That's why they live really long on a countertop and maybe not very long in a refrigerator. And even calling a virus alive or not alive is sort of a funny term as we have to think about that.
And like we said, we were at one point looking at using just heat to help I guess not re-sterilize, but re-clean our N95 mask. So again, we certainly know that heat for some amount of time can kill this virus. I think you're going to be safe ordering hot food for sure if you then eat it and get it to your plate in a controlled manner and wash your hands right before you eat. But if you want to order a salad, that should really be safe too.
So French fries, a lot of salt. I think that's bad environment for the virus. I'm just saying.
I think,
but it's not a good, healthy environment for you out there if you have heart failure, kidney disease, or any other problems related to salt. So be careful. Joe, are you eating French fries?
Oh, I don't eat French fries often anyway, Dr. Stites, but
I'm gonna bet you're so darn healthy. I've watched you.
Yeah, I think I know what Dr. was saying in terms of the issue about getting it safely onto your plate. I think that that people sometimes, the issue being that the packaging that it comes in is not necessarily sterile, or even you don't really know who has touched that, or whether that person might have what they had on their hands. So it's always best, I think, to wash your hands real well just before you eat, after you get it out of the packaging and it's all open just at that point. So remember that soap and water and hand washing is your best tool to try and prevent you from getting this when you're eating.
Yeah, I think that's right. All right, other questions?
What is the effectiveness of?
I have one more question regarding, as we get back to normal, about childcare getting back up and running. Should people feel safe allowing their kids to be watched by someone else? Or is that like can you let your guard down any as we move on?
Can we let our guard down and let child care resume? Joe, what's Johnson County's view of that? And we'll turn to Dana. And we'll blame that bad news on Dana, so go ahead.
Thanks. So child care has always been under restriction to licensed facilities. We've got a very careful supervision of licensed child care facilities in Johnson County. All of the facilities that are operating are carefully supervised by county personnel and frequently inspected. So that has been safe. That has been going on. That's never stopped. Child care has been considered an essential service the whole time. If we're talking about licensed child care services, if we're talking about family looking after each other, I think it kind of goes back to the same thing that Dr. Stites was talking about in terms of the bubble. If you've got people that have been in your family that have had contact with each other the whole of this time, probably it's not going to increase the risk any more than it has. And maybe those people have been in contact with those kids anyway during this time. So that's not really an issue. It's making that crossover and breaking, as you say, going outside the bubble. And that, I think, is an issue that we need to really consider real carefully. But in terms of licensed child care facilities, they have been working, they are working, they will continue working.
Yeah. Dana, there's one thing. Is it safe? Are they working? We think they're working. Yep. How safe is it?
Yeah, I mean, I think it's about as safe as we know, as far as when your children go to that child care facility. If we're talking about the licensed facilities, they are in contact with other children. We know children can have the disease and have relatively mild or no symptoms and spread it to one another. And I think then we go back to, well, if they have been going for some time, that's their bubble, but you just don't have any control over those other families and who their bubbles are. And so then you can just get into these mental and these mind games about, well, who's seeing who, and where are these other bubbles at and things of that nature. Again, I think it goes again to risk versus reward, and we know that people have to work. We know that childcare is essential, just like Dr. Lemaster said. So I think those are things that you have to consider when doing that.
Yeah, it's a big, all these are just hard choices, but you just have to weigh the world, and there is no truth in this. There's just relative risk. And I think that's one of our challenges, and hopefully we'll learn more about the truths of COVID-19 as we get a little smarter about it. But other questions?
I had somebody ask about swimming pools. Are swimming pools safe? And what about youth sports?
Okay, here we go. Yeah, it is a great question, Joe. What are you thinking? What is the county's guidance for swimming pools and youth sports?
So this is a real tough one. We're actually trying to determine what the right answer for swimming pools is right now. The sports fields and sports activities don't open up in the same all together all at the same time in phase one. So, for instance, gyms are still closed at this point. So we are seeking guidance from the governor's office because their orders are really kind of quiet about swimming pools, and looking at what the other county health offices are doing around the state about it. It's a little bit of an enigma. We're not real clear looking at the governor's orders about exactly where swimming pools fall into it. Generally speaking, you'd like in a situation wherever you're at, as we talked about, to maintain the 6 foot distance. But what does it mean to have 6 foot distance when you're all in a pool together where the water's all recirculating? So generally speaking, I would tend to think of that as something that would be happening at one of the later phases when we continue to monitor the downward trajectory of the virus and are not seeing a lot of increases in new cases. So that's my idea. But I think that we're still wanting to move in concert with the other health officers in the other counties around the state about this. Right now.
There's my echo. My kids think I echo in their minds when they're not doing the right thing. When you're in a swimming pool, there's a lot of chemicals in the pool.
Yeah.
Talk to me what chlorine does, or what do we know that it does to the virus? Maybe we don't know.
Yeah. As Dr. Lemaster said, soap and water is our best defense. Absolutely, I agree 100% with that. We know that this virus is pretty susceptible to regular household cleaners. I would not have a fear of the virus in the droplets if somebody coughs or sneezes going into the pool and causing infection. That's not the problem. I don't have a problem with if you can have an area outside the pool where people are maintaining 6 or 8 or 10 feet apart from each other, because adults, we can do that. For children, it's much harder because of they're just wanting to play in the rough housing, all that. But then when you talk about pools that may have a bar or a restaurant in that area and people can congregate around that area, that could be dangerous, as could be being in the pool near a lot of other people, because if you are talking or coughing or sneezing. In general, though, the virus inside of the pool in the water, I don't really feel would be a risk factor.
It's really the social behavior.
It's the social behavior.
And you know what? We keep coming back to that. We've said before that we flattened the curve because we sheltered at home. And we sheltered at home because it was a responsibility. And we all did that. And government asked us to do that. And they closed things to help make sure we did that. As we open it up, then that's great. But it's still about personal responsibility. And at some level, we have to continue to act responsibly if we're going to keep each other and our loved ones safe. Yeah. And we can't emphasize that enough, I think, that it is personal responsibility. And that, just because we're opening society up does not make it safe to big groups, right? That's not the case. It's still about personal responsibility. Jill, you had a question, I think.
What is the value of contact tracing?
Oh, boy. There's a lot of time at that being spent at the county health level, Joe.
That's right. Yeah. So the idea that what we're doing with contact tracing is if we have a known case, we're asking people who have been a close contact to that person to self-quarantine. So that gives them an opportunity to be able to watch real carefully if they develop symptoms. The idea would be that if the contacts develop symptoms, they've been in contact with somebody we knew to be a case, then they would be less likely during that incubation period to be out and about until we're sure that they didn't themselves catch the virus. So that's the idea behind it, is to try and keep people that we know that were in close contact with somebody who is a case in a situation where they're not spreading the virus if they develop it and they're still asymptomatic. So we know that there's a period, maybe even a pre-symptomatic period of a couple of days, where people can be out spreading the virus and not really know that they were sick yet. So this is the whole point behind it. It's the contact tracing is trying to help those contacts stay out of open circulation as much as possible during that time.
Yeah.
Yeah.
All right. Time for one more question.
Are we getting, this is from Channel 41, and I think they've been trying to get in, but they're having
the Zoom problem, so Channel 41, you bet.
And the question is, are we starting to bring people back into the OR? And are we bringing people back in for clinic visits?
You bet. We are starting to bring people back into the operating room, and let me talk a little bit about why that is. When we closed hospitals, we never really closed hospitals. When we stopped doing elective surgeries, we tried to cut back on clinic visits. It was for two reasons. Reason number one is we tried to preserve PPE and the demand on hospital resources. And we were really successful in doing that. And really, most of the hospitals around have done that and have done a great job of it. The second thing is we're trying to reduce the risk for patients to come into areas until we had all our infection control figured out and had all our kind of our remapping of how we are going to do our daily work completed. And I think we've been very successful on that account. So we are concerned because we know that there's increasing evidence and very strong evidence that people are not coming to the hospitals or their physicians because they are concerned about the level of disease there, and as a result, they are getting sick from their base problems. For example, we know that the risk of heart attack and death from heart attack has gone up because people are staying at home. People are having strokes at home. We can help with those things, and so we don't want to send a message that hospitals or offices are closed. We're here to treat the folks who need them. And we know that sometimes delays in care can get too serious. For example, yesterday, a case came up where someone said, can I come and get my back surgery done? Because their symptoms had gone from pain to what's called radiculopathy, and they were losing sensation in their leg and having difficulty walking. Well, by all means, we need to get that done. And so now that we have enough PPE and we have enough medication to be able to do general anesthesia and to handle a surge, we are saying yes. Let's go ahead and do more surgeries than we were doing before. We're not wide open. We're still not doing the most elective of cases. But unfortunately, we've canceled or we had to postpone over 3,000 cases, and some of those are no longer elective. And so we are in fact opening up the operating rooms in order to be able to service more folks. And the same thing's true in the clinic. What's different is we've totally changed our workflow in the clinic to make sure people stay safe. Before, you would come and you might have a crowded waiting room and you'd sit there for half an hour, et cetera, and you'd be around a lot of people. That's gone. Instead, we have rebuilt our programs in the ambulatory practices to handle about half the volume they were before, and doing it in a much more controlled fashion. And you'll see in the coming days, we're extending hours, we're going to add Saturdays, because we want to have people to be able to come to their physicians, but it's going to be in an environment in which they can come safely in, have the visit. They're going to have a mask, we're going to have on masks and PPE, and then the patients are going to leave, and they're going to leave through a separate entrance. And by doing that, we control the flow. So we've really reinvented ourselves in a very short period of time. So yes, you can now come see your doc, and yes, you can have your surgeries. Again, the most elective of procedures, we have not restarted doing that yet. And so I think that we're trying to do that in a really safe environment. Jill, any other things that we weren't able to get into this so far?
No, we're
All right. Let me just ask Joe, parting thoughts or comments or special important messages you'd like to leave with us today.
Thanks, Dr. Stites. Well, the main thing that we continue to say is for this next week, especially for people in the Kansas City metro area, it's stay safe, stay strong, and stay home, we say. So we have one more week of this before we start moving into phase one, and I think we'll be in that at least for a week, and we're taking very close contact with the governor's office, looking for guidance about how we'll move forward thereafter into the additional phases. So we thank everybody for their continued following of the public health guidelines and participation with us in all this.
And Joe, we want to thank you for your leadership. I know you are working probably 26 hours a day and doing a great job of it. And you and Alan, and I apologize we couldn't get Alan today, we'll get him back, have really helped lead the way, and to our county health departments. And again, a special shout out to the Core 4 who have worked together so our whole area doesn't come discoordinated. And it's going to be fun to watch KU play again in basketball and football, but it's even better to watch the Core 4 work together. Dana?
Yeah, so you said as we're opening up, and we have been always open for people to come here who are ill, who need treatment. We do continue to need blood and blood products for our trauma patients, for our surgery patients, for our cancer patients. The University of Kansas Medical Center is partnering with Community Blood Center now. There is a space right here on the University of Kansas Medical Center campus that we are holding a blood drive. So please contact the Community Blood Center and come. If you're able to donate, please come and donate.
Yeah. A lot of our questions about, is it okay to do this or is it okay to do that? And you wish there was a holy grail in this disease that allowed us to give a straightforward answer. And unfortunately, we can't. What we can do is try and give you information. On this program, it's for the however long we've been doing it now, it's really about trying to give you the information to make good choices. And we know that most people make those good choices. And we encourage you to keep doing that and to take the information you hear and teach it to others, because we try to do it without politics and without, a lot of decoration or a lot of agendas. It's just trying to tell the truth. And I think at the end of the day, we're trying to make sure that everybody understands, because you're going to have to make personal choices and weigh your own risks and benefits. And as you do that, remember that it really is about those same core principles we keep saying. Keep your distance, wash your hands, don't touch your face, cough into your elbow, don't go out when you're sick. And if you really want to stay safe, there's still no place like home. Thank you all for being here today. We'll be back tomorrow. We'll see you then.